Hi, I'm Dr. Mike Evans, and this is Locker Room Doctor.
Locker Room Doctor.
In this episode, Dr. Alan Ackery gives us some tips to recognize a possible concussion on the ice and the single most important thing to do if we suspect one.
Two teams of men play recreational hockey. A player is checked into the boards and falls to the ice. He stares up in a daze, shaking his head slightly. He slowly returns to his feet and unsteadily makes his way back to the bench. He takes a seat next to two other players who watch him with interest.
Fred, man, you okay? I like ice cream and Nickelback.
They share a concerned glance.
Okay, everyone loves ice cream, but Nickelback? I think you need to see a doctor, buddy.
He's fine, aren't you, Fred? Aren't you, Fred? Aren't you?
Fred stares off into the distance, unaware.
Okay, Fred. How many fingers am I holding up?
As he holds up 3 fingers, a double image glides over them.
6. See? Needs help.
Well, if you're seeing 2 hands, then the total would be 6.
You're an adult.
Doc, we need you over here. I think Fred's got a concussion.
Nah, he just got his bell rung. He didn't lose consciousness.
You don't actually need to lose consciousness to have a concussion. It's serious, and you don't want to take any chances. Any suspicion, you should stop playing. If you don't sit out, it could get a lot worse. How you feeling there, Fred? A little confused?
I'll have strawberry ice cream with sprinkles.
Yeah, I think there's probably something wrong here. It's tough to do without medical training, hard to assess, especially at the rink. But there are cognitive and physical signs that you might notice right away. Most common is headache.
Feels like a saw running in my head.
You can also have dizziness, ringing in the ears, just feeling out of it with a blank or vacant look.
Fred looks ahead with a confused stare.
Yeah, that is a pretty vacant look, even for Fred.
If you just feel off, increased weakness or coordination issues, sensitivity to light or noise, you can even have short or long-term memory loss.
Hey guys, I'm feeling better. Any chance I can get back out on the pitch and score us a couple of touchdowns?
The top priority is safety. Anything seems off, you're better to be benched. Watch for symptoms, and even if you're feeling better, it's better to quit for the day.
Do you think you need to go to the hospital, Doc?
Well, if you still feel off and you have symptoms, you should follow up with a healthcare practitioner. The more serious symptoms require a visit to the emergency department. So loss of consciousness, vomiting, blood from the ears or nose, slurred speech, convulsions that may be a seizure, you probably need to go to the emergency department to get some imaging. The big point here is to stop playing. Be aware of your symptoms and have your family and friends monitor you for a couple of days. You may need appropriate follow-up with a healthcare practitioner. Now, actual concussion return to play guidelines should be managed by someone who actually knows what they're doing, usually a healthcare provider.
Hear that, Fred? You're gonna have to keep an eye on things for the next few days, especially the serious stuff. Okay, but can you do me a favor?
Name it, bud.
I'll have strawberry ice cream with sprinkles.
Locker Room Doctor. LockerRoomDoctor.com. The information and references contained in this video are intended solely for the information and education of the viewer. Copyright 2019, Reframe Health Films. Produced with the participation of TELUS Fund, a Movember Foundation-funded project.